Welcome to the first critical step of a patient's hospital stay. The admission process establishes their clinical baseline and builds immediate trust. Our goal is straightforward. By the end of this process, the patient must be physically safe in their new environment, legally documented, and clinically assessed so their treatment can begin. Before the patient even arrives, verify your starting requirements. Check that you have the admission advisory form and ensure the bed is sanitized, fully made, and ready. Next, the admission consent form must be duly signed by the patient or relative so treatment protocols can officially proceed. Completing these checks before arrival eliminates administrative friction. It ensures that the moment the patient enters the ward, your attention is focused entirely on their immediate clinical condition, rather than tracking missing paperwork. Step 1 in room preparation is physical access. Lower the bed to its minimum height and fold down the top sheet and bedspread so the patient can transition smoothly from a stretcher into the bed. Next, clear the pathways. Arrange the room furniture to provide easy, unobstructed access from the doorway to the bed, directly reducing the risk of a fall during the transfer. Check life-saving equipment, suction and oxygen supplies. Start with respiratory support. Test the oxygen flow meter for correct pressure, and verify the humidifier bottle is connected. Next, for airway clearance, check the suction canister for a tight seal, and ensure the Yankauer is attached. Testing this equipment before arrival prevents critical delays. If an emergency cardiovascular event happens during admission, your intervention tools are already online. Gather your baseline diagnostic tools at the bedside. You will need a functioning thermometer tray, a BP apparatus, and a weighing machine to capture initial vital signs. Next, prepare the hygiene kit. Place a kidney tray or emesis basin, a bedpan or urinal, tissue paper, and clean bath towels within reach. Assemble your document package. Review the doctor's order sheet and the TPR sheet to track vitals. The core of your physical examination is documented here on the nursing assessment form, providing a structured checklist for categories like consciousness, mobility, and skin condition. Stocking these physical and digital tools at the bedside eliminates wasted nursing footsteps. You won't leave a newly arrived patient unattended to search for a missing thermometer or chart. When the patient and family arrive, receive them cordially. Immediately verify their identity against the admission slip, confirming details like their advanced payment status and their assigned unit and room. Escort the patient to the room and orient them to the physical space, pointing out the nurse's station and facilities. Clearly explain hospital policies regarding visiting hours and gate passes. Finally, inform them about essential services and basic safety rules related to fire. By familiarizing the patient with their environment, you reduce the stress of being hospitalized, making them more comfortable and improving their cooperation with upcoming treatments. Now acquire the clinical data. Check the patient's weight and accurately record vital signs like blood pressure and pulse. Next, collect a detailed medical history and perform a physical examination to observe their general condition and note any immediate complaints. Address personal items by encouraging the family to take valuables home. If the patient prefers to keep them, list the items on paper, secure a signature, and place the items in safe custody. Before you step away, execute the final 3 safety checks. The bed is in its lowered position, the side rails are raised, and the call light is placed directly within the patient's reach. These final adjustments create a secure physical zone. The patient is protected from falls and can independently call for assistance while you complete administrative tasks. Wash your hands and step away to notify the physician of the patient's arrival, reporting any unusual clinical findings you discovered during your assessment. Next, inform the dietary department regarding the patient's arrival, so the correct type of prescribed diet can be scheduled. Write your final admission notes in the nurse's record. Document the exact date, time of arrival, age, mode of arrival, and primary complaints. Add any condition-specific charts required by the physician, such as a diabetic urine or intake-output chart, to complete the documentation. The patient is now secure, their baseline history is documented, and the care team is notified. You have completed a systematic and safe admission process.